The floor.
Mr. President, I have the honour to make this statement on behalf of 82 delegations. The full list of delegations is in the written copy that is being circulated of my statement, and to that list should be added Rwanda and Maldives. Mr. President, our delegations express concern at the unacceptably high number of women who die every year during or after pregnancy and childbirth, or for reasons associated with childbirth. The panel event on maternal mortality in the Human Rights Council's June 2008 session clearly highlighted that there are human rights implications to be taken into account in addressing maternal mortality. It's estimated that more than 500,000 women die each year as a result of pregnancy or childbirth. Most of these deaths are preventable. The failure to prevent them is an impediment to the universal realisation of human rights and could constitute a violation of human rights, including women's right to health, life, education, dignity, access to information and appropriate health care. This is not an issue that affects only one region or one culture. Maternal mortality and morbidity affects women and their families in all countries, in all regions, but it is exacerbated by factors such as poverty and multiple forms of discrimination. In the Convention on the Elimination of All Forms of Discrimination Against Women and the International Covenant on Economic, Social and Cultural Rights, as well as in the Beijing Declaration and Platform for Action and the International Conference on Population and Development, we have committed to ensuring that women have access to appropriate health services and special protection before, during and after pregnancy and childbirth. In Millennium Development Goal 5, we committed to reduce the maternal mortality ratio by 3/4 between 1990 and 2015. Despite these commitments, many challenges remain in the realisation of women's access to appropriate services and special protection before, during and after pregnancy and childbirth. Globally, the maternal mortality rate has decreased by less than 1% between 1990 and 2005, which is far below the 5.5 annual improvement needed to reach the MDG target, and indeed in some cases there has been no discernible reduction. Mr. President, poverty is a contributing factor in many deaths, and accordingly we recognise the need for partnerships on maternal health through development programs, dialogues, internal cooperation and technical assistance. At the same time, we recognise the need for all states to respect their human rights obligations. Good practices in several developing countries have reversed the rate of maternal mortality and morbidity, showing that it is possible to make a difference by strengthening healthcare systems, for example through increased access to skilled healthcare professionals before, during and after pregnancy and childbirth. We recognise the leading role of the World Health Organization to reduce the maternal mortality rates and to achieve MDG 5 in cooperation with other organisations such as the UNFPA and the Partnership for Maternal, Newborn and Child Health, UNICEF and the World Bank, as well as civil society. Mr. President, we believe that the Human Rights Council can contribute to reducing maternal mortality and to achieve MDGs 5A and B, as well as other MDGs that address the wider economic and social determinants of health which contribute to the realisation of MDG 5. And the written version of the statement, Mr. President, contains a number of ways in which the Human Rights Council can do this. I shan't read them in the interest of time, but would ask colleagues to look at the written statement. Mr. President, finally, the Council's actions in the respect I've just mentioned should contribute to the global strategy aimed at achieving all MDGs, and in particular those related to health. Our delegations, those who I've mentioned, remain committed to addressing human rights and maternal mortality through constructive and coordinated contributions to existing efforts. We must renew our political will at all levels to combat the unacceptably high number of preventable maternal deaths. Our first priority is to raise awareness of the human rights implications of maternal mortality. Those 82 delegations that are party to this statement look forward to working with all delegations in the coming months to ensure that the Council takes collective and concrete